Exercise Medicine Global Health Network is what we call it, is really just a community of exercise is medicine national centers across the world. So a national center is really the coordinating body for everything that happens in the country. So as an example, we help ensure that there's excellent people involved with exercise medicine here in Poland. And once we know that the right people are involved and the right connections, we want to turn over independence to them because they know what is best for Poland. And so we get the right people in place, we turn it over to them, and they work in kind of coordinating the country like Anna and Gosia have done here in Poland. So we have approximately 30 developed national centers around the world right now. We have about 10 or 12 other countries that are in the process of forming it. It doesn't happen overnight. We really are quite stringent about having the right people, because once we form that partnership, you're part of the family, you're part of the network, and our goal is to make this work for 1, 2, 5, 10 years down the road. I hope to be back here in 10 years to look at what Anna and Gosia have done here in Poland and how far they've advanced it. So the network is just a beautiful connection of all these national centers where we share best practices. One of the things, like for example here in Poland, I'm so impressed with is the media presence, is how well they do media and marketing communications. And other countries don't do it as well. So we're going to take this message and share it with them. But in other countries, they might do something else really well that we can share back here. And the whole goal is to share best practices. And we were just speaking right here about how European countries are banding together to put grants and proposals together as a collective region for the European Union to gain funding to advance the work they do as an entire collective group instead of just individual people. So exercise is important in the healthcare system. Well, I mean, WHO listed physical inactivity as the fourth leading cause or fourth leading risk factor for mortality worldwide. So it's actually more important in terms of mortality than cholesterol, than obesity. But when you go to the doctor, what do you hear? You hear, well, we have to take your cholesterol levels, we have to weigh you, we have to do all these things, but the facts, the data are showing that exercise, fitness, physical activity levels are more important predictors of overall health and mortality than all these other things. So if it's that important, why aren't we doing it? And I think the reason why we're not doing it is we don't have a good system. You know, when you go into the hospital and they take your blood pressure, there's a system. Oh, your blood pressure is this high, we need to put you on, you know, a low salt diet. Or it's so high, we need to give you this medication. But there isn't that same system developed for exercise, and that's the whole point of exercise medicine. And they've done a beautiful job here in showing, well, I'm a doctor, if you're a patient that comes in that's inactive, I'm going to make sure it's safe for you to exercise, and then I'm going to connect you to an exercise professional that's trained to work with patients. And as part of that, we're going to connect the two, and we're going to develop that system just like we have 20, 30 years ago with blood pressure and whatnot. And so that's why I think it's so key that if physical activity really is so important for health, which we have thousands and thousands of papers, then we have to find a way to make it part of our health system, to make it part of our overall healthcare package.